future mommies. If you clicked on this video, you're probably around 10 weeks pregnant. Congratulations. In today's video, we're going to talk about a few common symptoms you might be feeling, what to expect at your next OB appointment, including some genetic tests your doctor might offer, and how your baby is developing right now. You're watching the Health and Medical Zone. If you're new here, I hope this channel finds you in good health and great spirits. And if you love staying healthy and happy, make sure to hit that subscribe button because you're in the right place. If this is your first time on my channel, congratulations again on your pregnancy. After watching this video, I recommend checking out some of my earlier pregnancy videos. I started this series at week 4 and cover lots of different topics that you might find super helpful. But for now, let's dive into week 10. At week 10, you're halfway through your 3rd month and have about 30 more weeks to go. You're also nearing the end of your 1st trimester, and you're doing amazing. Another way to look at it, since pregnancy is about 40 weeks long and you're 10 weeks in, you're already 1/4 of the way through. Right now, your baby is about 1.5 inches long, roughly the size of a date. At this stage, all of her major body organs have started to form. She's developing teeth inside her gums, and both bones and cartilage are beginning to take shape. Her elbow and knee joints are forming too. The stomach is starting to produce digestive acids, and the kidneys have begun to function, even making a tiny bit of urine. Her fingers and toes are lengthening. The little webs between them are disappearing, and she's now forming eyelids that she can actually close. Technically, your baby is no longer called an embryo. She's now officially a fetus. That's the medical term, but for us, she's simply your precious little baby growing beautifully inside you. Now, let's talk about some of those 1st trimester symptoms that many of us experience. You're probably feeling exhausted from the moment you wake up until you crawl back into bed, and that's completely normal during the 1st trimester. The good news is it usually eases up by the 2nd trimester, so hang in there. You're almost through it. In the meantime, if you need a nap, take it. Seriously, you're creating a human being. That's major work and deserves all the rest you can get. Go to bed early, sleep in if you can, and yes, hit that snooze button a few times, guilt-free. You might also be noticing some heartburn. Your body is producing a lot of hormones right now. 2 key ones are called relaxin and progesterone. One of their jobs is to relax the smooth muscles throughout your body, including those in your gastrointestinal tract, like the esophagus, that tube connecting your mouth to your stomach, and your intestines. When those muscles relax, food moves more slowly through your digestive system, which can lead to indigestion and gas. There's also a ring of smooth muscle at the bottom of the esophagus that normally keeps stomach acid where it belongs in your stomach. But when that muscle relaxes because of progesterone and relaxin, some of that acid can sneak back up into the esophagus, causing that uncomfortable burning known as heartburn. While a burning sensation in your chest or upper stomach is the most obvious symptom, heartburn can also show up as a sour taste in your mouth, bad breath, a sore throat, or even a mild, annoying cough. So let's talk about how to help prevent heartburn. Don't lie down right after eating when you do. Stomach acids can more easily creep up into your esophagus. Try to wait a few hours after dinner before heading to bed. Avoid spicy or greasy foods. Eat smaller, more frequent meals throughout the day. When you do get heartburn, there are a few easy, medication-free ways to help ease the symptoms. Ginger acts as a natural anti-inflammatory, and the combination really helps take the edge off heartburn. Plus, as an added bonus, it can also help with morning sickness. You can try drinking milk. It can soothe your stomach and temporarily relieve discomfort. Chewing sugarless gum about 30 minutes after a meal helps increase saliva production, which neutralizes excess stomach acid. You can also try eating a few almonds after each meal. They can help balance stomach acidity too. If none of these home remedies help, you can safely try over-the-counter Tums or Rolaids. Both are considered safe during pregnancy. And they even give you a little extra calcium, which is great for you and your baby. There are other over-the-counter options, like Prilosec or Pepcid, that are also safe in pregnancy, but I always recommend talking to your OB before starting any of those. Now, let's move on to one of my favorite parts of this stage, the 10-week ultrasound. I like to call it the cinnamon bear stage. You can clearly see your baby's arms and legs now, and the head makes up about half the length of the body. Your uterus is now about the size of a grapefruit. While that's not yet noticeable to most people, you might start spotting a little bump in the mirror. Keep in mind that everybody is different. If this is your first pregnancy, you might not start showing for a few more weeks. But if it's your second or third, you might already see that adorable bump taking shape. So don't stress if your belly doesn't look exactly how you expected or how those curious strangers at the grocery store think it should. If you ever feel uncertain, talk to your doctor. That's what they're there for. Now, if you haven't scheduled your first OB appointment yet, definitely do that soon. I covered what to expect at that first visit in my week 6 video, so make sure to check that one out. At your next appointment, your OB might bring up optional genetic testing that can be done in the first trimester to screen for certain abnormalities. This kind of testing is completely up to you. There's no right or wrong choice, but it's good to know your options so you can make an informed decision. Between weeks 10 and 13, a combination of an ultrasound measurement of the back of your baby's neck, called nuchal translucency, along with some blood work, can help estimate the risk of conditions like Down syndrome, trisomy 18, or spina bifida. There are also tests that can be done in the second trimester, and we'll talk more about those in a few weeks. So make sure to hit that notification bell so you don't miss it. You'll also start noticing more changes in your body now. You might see bluish veins appearing on your breasts or abdomen. That's just increased blood flow, helping support your growing baby. Your breasts may be getting fuller, and the darker area around your nipples, called the areola, might be darkening too. As your pregnancy progresses, you might even see veins in your hands and feet becoming more prominent. Your feet themselves might go up half a size, and sometimes they don't shrink back after birth. So don't be surprised if you find yourself shopping for slightly bigger shoes. Your body is doing incredible work as it prepares for this pregnancy. While your uterus is now about twice its normal size, it's still a little early for maternity pants. Right now, it sits just above your symphysis bone at your pubic bone. When you go for your monthly OB visits, your doctor might use a measuring tape to measure your uterus from your pubic bone, the symphysis pubis, to the top of your uterus. The measurement is taken in centimeters, and here's the cool part. The number of centimeters often matches how many weeks pregnant you are, give or take a centimeter or two. So, if your uterus measures 16 centimeters, you're likely around 16 weeks along. Pretty cool, right? Now, let's talk about morning sickness. If you haven't felt it by now, you might be one of the lucky 10 to 20% of women who don't get it at all. For everyone else, don't worry, it usually fades within the next few weeks. If your morning sickness has been rough, keep snacks nearby at all times, because nausea tends to be worse when your stomach is empty. Drink plenty of fluids, but don't gulp them down. Instead, take small, frequent sips throughout the day. Try ginger tea. It's safe during pregnancy and great for soothing nausea. Preggy Pops are another favorite. They're easy to carry and work because they contain vitamin B6, which has been proven to reduce nausea. Another helpful option is Unisom, which you can find in the over-the-counter sleep aids section. But be careful, there are two kinds. Don't get the one with the generic name diphenhydramine. That's just Benadryl. The one that helps with morning sickness is doxylamine. You can take Unisom with or without vitamin B6. But as always, talk to your OB before starting any medication. There are also prescription medications like promethazine or Zofran, but you'll need your OB to prescribe those. If you're vomiting so much that you can't keep anything down, even with medication, call your doctor right away. You might have something called hyperemesis gravidarum, which means severe vomiting during pregnancy that can cause dehydration. Don't wait. Your OB can help you manage it safely. For most women, though, morning sickness improves by the end of the first trimester, around week 12 or 13. So hang in there. It should ease up very soon. Now, it's time for your tip of the week. You already know to take your prenatal vitamins every day, drink plenty of fluids, eat enough fiber, and wear sunscreen. But this week's tip is get enough vitamin D. It's common to be a little low in vitamin D, but right now, your baby is developing teeth, and vitamin D is essential for strong teeth and preventing cavities later on. Eat foods rich in vitamin D, like fatty fish, eggs, fortified dairy products, and orange juice. And talk to your doctor about whether you might need a vitamin D supplement. Lastly, just a reminder, this video is for educational purposes only. It's not meant to diagnose or treat you. If you have any questions or concerns, make sure to talk with your OB. During your first trimester, you should be seeing your OB about once a month, so be sure to go to all your appointments. I hope you enjoyed this video. Don't forget to subscribe and turn on notifications, so you'll be the first to know when the week 11 video comes out. Click on that next video, and I'll see you over there. Thank you so much for watching.